I joined the speed specifically because I searched a lot of apps, but no were giving us a radio diagnosis group as such. Speed was the only app that was giving us a radio diagnosis MCQs and the videos. So I have solved actually all the MCQs and all the grand tests from the speed app itself. And the grand tests have literally helped me a lot to get back to my basic MCQ solving skills, which is really very important when you are attending any sort of entrance exams. So I do remember one of the PSM grand test in the speed that they have curated 150 question total
Yes.
PSM GT. So that was really helpful. I'm really thankful to all the speed faculty, Doc Special end session videos. They were very helpful. I'm really thankful to him and all the grand tests and all the MCQs that Speed App has given me to practice before my exams. I'm really thankful to it.
So I bring in all the wishes and greetings on behalf of Speed Medical Institute and faculty members of Speed Medical Institute to Dr. Archana Maurya for scoring a topmost rank of 4 in DM Radio Diagnosis Group in NEET SS session 2025. Congratulations to you, Doctor.
Thank you. Thank you so much, sir.
Great, Doctor. I need to thank you for sparing your time to share your valuable experiences with us.
It's my pleasure, sir.
Doctor, can we know your brief background from where you started till date, what all you have done?
Yes, sir. So I have done my MBBS from Government Medical College, Meerut, and I have done my post-graduation DNB radio diagnosis from Jahangir Hospital in Pune. I completed my residency in November 2025 and gave a NEET SS exam in December 2025.
Excellent. Fantastic, phenomenal achievement. And now, why super specialty in radio diagnosis? I mean, what super specialty you are interested in? Can you share something on that?
I'm quite interested in peripheral IR, sir. And I have decided to do intervention radiology even before joining my post graduation in radio diagnosis. So I had an interest in that only, sir.
Okay. So once you decided to do a super specialty, what all you did and what all the way you worked to achieve a topmost rank like this today, can you share your preparation strategy?
Yes, sir. I had this thought in my mind that I have to do a super specialty in intervention radiology. But during the PG, it was really difficult to like literally focus on this DM entrance exam. So I really had no schedule as such to prepare for this DM entrance exam. After clearing my theory and my practical, it was I thought that I have to be more particular about this exam, and then I oriented myself to this DM entrance exam. So I started preparing after getting my this practical results declared, and then I started doing it. But before, it was like I never practiced MCQ as such, but the concepts were actually clear. Whenever I used to see a cases or whenever I used to report cases, I used to make a habit of having a good concept about the cases and the theory, particularly regarding that case. So.
Okay.
And after I completed my practical examination, I joined the speed specifically because I searched a lot of apps, but no were giving us a radio diagnosis group as such. Speed was the only app that was giving us a radio diagnosis MCQs and the videos. So I have solved actually all the MCQs and all the grand tests from the speed app itself. And the grand tests have literally helped me a lot to get back to my basic MCQ solving skills, which is really very important when you are attending any sort of entrance exams.
Doctor, can we know how many questions you attended this exam?
So I attended in total 143, sir.
Great. Doctor, can we know about the paper itself? What they asked the paper? What is the focus on? I mean, what are the areas they are asking us in a gross, we can say it will be useful for the students?
I really don't know about what the paper was exactly in the last year, sir. But this year in section one, the paper was more so focused on the PSM and the physics part. And that too, physics part was somewhat from the basics and somewhat from the advanced level of the MRI, sir. And they have went to in depth to ask the PSM questions, sir, which was really shocking to me because I expected some sort of a biostat questions from the PSM, but they were like quite 15 to 20 questions from the PSM, which was shocking in the first section of that entrance
Was it
exam.
related to radio diagnosis or general PSM question?
General PSM questions are not specific to radio diagnosis as such, sir.
Looks a little vague.
Yeah, so I do remember one of the PSM grand tests in the speed that they have curated 150 question total
Yes.
PSM GT. So that was really helpful.
Okay. Because we never knew what they will do. I mean, it's better to have one like that so that the students, in
Yes,
case
sir.
they can use it. That's the idea.
Definitely, sir.
Okay.
And rest of the section were more of a clinical based only, sir. Uh, the MCQ, I feel like the image based question was more last time, but this time the image based questions were less because they have integrated more of physics and the PSM, which made the image based questions to be less in number.
Okay. And or more general radiology, rest of the sessions, or more of IR or specialty? I mean, what kind of distribution it was?
More of a general radiology was there. So IR questions were there, but they were few and they were not so much of a core IR as such. With a general radiology or a resident who is doing a basic IR procedures in their residency, they would be able to answer those questions. So that was not very hard for intervention radiology questions, I felt so.
Okay. What is the message that you want to give for the future aspirants of TM radiology group, radio diagnosis group?
For the people who are aspiring to do a DM, I would suggest them to have two basic things very clear. One of the most important things is to get your concepts really clear. Even after you know your concepts, you have to sharpen your MCQ solving skills, which is most important to clear any entrance exam, particularly, sir. And for that, you need to have a grand test. You need to have MCQs that you have to solve on day-to-day basis, sir, before appearing for your exams.
Okay. Now, time to thank, and whom all you want to thank that you feel that they have helped you from day one till date in your career. You can use this platform to
I
do so.
would I would like to thank my family and all my colleagues. They have supported me during this journey. They have more confidence in me than myself that I'll be able to clear this exam. So I'm really thankful to them. I'm really thankful to all the speed faculty, Dr. Adit Cambodia, the special end session videos. They were very helpful. I'm really thankful to him and all the grand tests and all the MCQs that Speed App has given me to practice before my exams. I'm really thankful to it. And I'm really thankful to my residency mentors. They have guided me throughout this journey of residency of 3 years that has helped me do this MCQ based exam really very much clearly.
Very good, doctor. Excellent. Once again, I congratulate you, wish you all the very best and all the success for a great and amazing career in a
Thank
DM
you. Thank you so much, sir.
diagnosis. Best wishes to you, doctor.
Thank you. Thank you so much, sir.
Thank you.